I'm Dr. Sarah Ballantyne, and this is the Autoimmune Protocol Lecture Series, Week 1, Lecture 3. What is autoimmune disease? So we've talked a lot about chronic disease in general, but let's get into what autoimmune disease is specifically. It's actually any of probably at least 140 different diseases, but they're all caused by the same thing. They're caused by the immune system attacking tissues in the human body. They're all difficult to diagnose. So approximately 45% of patients who are later diagnosed with a serious autoimmune disease are labeled as hypochondriacs in the early phases of their diseases. Getting an autoimmune diagnosis can be one of the most frustrating experiences, and for some people, it takes decades. They're chronic and they're lifelong. There's no cure. The autoimmune protocol is not a cure. We'll talk about that more later. We can put autoimmune disease into remission, though, and that can feel like a cure. Medical treatments currently are very limited. So they basically are just symptom management, and there's some options available that are immune suppression, which are problematic because even though they can be life-saving from an autoimmune flare, they dramatically increase risk of cancer. There's something like 50 to 60 million Americans who are affected by autoimmune disease, and the incidence is continuing to increase. In fact, autoimmune disease is probably our nation's biggest health obstacle. There's the fewest available medical interventions, so there's not very much that we can do for this huge number of people who are suffering daily. And the high direct healthcare costs are matched with even higher indirect healthcare costs. So, for example, we certainly see that heart disease and cancer can have really, really high direct healthcare costs, in part because there's more medical intervention options for those people. But indirect healthcare costs for autoimmune disease could be in the many, many billions of dollars. And this is seen in lost work days, inability to contribute to the economy because of inability for people with some autoimmune diseases to function in a normal workplace. These types of things are not just impacting people at a very personal day-to-day level, but they're impacting our entire society because these people are not able to contribute the way they would if they were healthy. And unfortunately, this is also matched by very, very little funding for medical research. So we have these huge government funding grants for heart disease, for cancer. It's a big pharmaceutical industry to find the next wonder drug for treating cancer, for preventing heart attacks. There isn't really an industry like that for autoimmune disease. So we're pairing a big public health problem with very little by way of innovation for medical intervention. Now, there are some autoimmune diseases that are much more common than others, and some of these more common autoimmune diseases have diagnostic tests that make them a little bit easier to diagnose. So Hashimoto's thyroiditis, this is the autoimmune disease that I have. It's an autoimmune condition in which the thyroid does not make enough hormones for the body's needs because it's being attacked by the immune system, and it affects up to about 1 in 34 people. It's the most common autoimmune disease. Sjogren's syndrome affects up to about 1 in 29. This is an autoimmune disease that is characterized by dry eyes and dry mouth. Celiac disease affects up to about 1 in 53. This is an immune reaction to eating gluten, which is a protein we're going to be talking about a lot, found in wheat, barley, and rye, that results in pretty devastating damage to the intestinal tract. Alopecia affects about 1 in 59, and this is characterized by sudden hair loss. Typically starts with 1 or more circular bald patches and may overlap. It's a very challenging disease to have, and it has very, very high incidence rate. Psoriasis affects about 1 in 65. This is another autoimmune condition that I have. It's characterized by skin cells that build up and form scales and itchy dry patches, sometimes limited to just the scalp, sometimes full body. Type 1 diabetes is an autoimmune disease that affects up to about 1 in 106 people. This is a chronic condition in which the pancreas doesn't produce enough insulin, or perhaps no insulin whatsoever. Rheumatoid arthritis. This is a disease that we tend to just associate with old age. Oh, we're just going to get arthritis as we get older. It's an autoimmune condition. That means that it's preventable and we are not doomed to get arthritis in our older years. It affects up to 1 in 123 people, and it's a chronic inflammatory condition that affects many joints, typically starting in hands and feet, but it can move to any joint in the body. Polymyalgia rheumatica affects up to 1 in 135. And this is an inflammatory disorder that includes muscle pain and stiffness around the shoulders and hips. Graves' disease is another autoimmune thyroid condition, but in this case, there's overproduction of thyroid hormones. This affects up to 1 in 160 people. Multiple sclerosis affects up to 1 in 279 people. This is a disease in which the immune system eats away at the myelin sheaths, these protective coverings of nerve cells, and it results in a variety of neurological symptoms affecting every system in the body. Ulcerative colitis, which is a type of inflammatory bowel disease, affects up to 1 in 264 people. And in this particular disease, there's inflammation and sores or ulcers in the lining of the large intestine. Crohn's disease is the other inflammatory bowel disease, and this can affect any part of the gastrointestinal tract. Now, those are just some of the most common autoimmune diseases, right? There's 140 of them, all caused by this dysfunction of the immune system. So the immune system, instead of protecting us from a foreign invader, like a virus or bacteria or parasite, has learned to attack something in our bodies as though it is an infectious organism. So it sees our joint tissue or our thyroid or the myelin sheaths around our nerves as some kind of foreign invader that must be vanquished. So we have this huge class of autoimmune diseases, but there's also these frequent comorbidities. So we see this collection of conditions that often go along with autoimmune disease. And having one of these conditions can be one of your first signs that there is an underlying autoimmune disease that's sort of the real culprit. So this includes a lot of issues related to gallbladder health. This includes chronic fatigue syndrome, which is itself a suspected autoimmune disease, eczema, fibromyalgia, which some people consider an autoimmune disease, some people just say it's a suspected autoimmune disease, and polycystic ovary syndrome, or PCOS. In fact, we see PCOS particularly frequently at the same time as autoimmune thyroid conditions. So I mentioned already that autoimmune disease is on the rise. We have seen increases that are absolutely dramatic in the last 50 years that can't be attributed just to better diagnostic procedures. This is absolutely higher rates of these diseases. And in fact, studies that have looked at how quickly the incidence of autoimmune disease has increased has shown that the net percent increase per year of autoimmune disease worldwide is something like 12% in terms of prevalence. So 12% more people every year are living with a diagnosed autoimmune condition, and the incidence is increasing. So the incidence is how many new cases there are. The prevalence is how many cases exist. So the incidence is increasing 19% per year. So every year, there's 19% more people diagnosed with autoimmune disease than the year before, and there's 12.5% more people living with an autoimmune condition than the year before. These are dramatic numbers, and they should be scary because they are. But what's really important information that I want you to focus on right now is that as much as living with autoimmune disease is terrible, as much as the incidence is increasing, as much as these run in families, there is tremendous therapeutic value in diet and lifestyle choices, better than any medical intervention available for autoimmune disease. And that is the information that I want you to focus on and feel empowered by, because you are taking this lecture series in order to get all of that information. Now, approximately 78% of autoimmune disease sufferers are women. And it's different for different diseases. So there are some conditions in which it's extremely skewed towards women, like Sjogren's syndrome. And there's other conditions in which men are actually more likely to get it. For example, type 1 diabetes. But overall, we see that women are much more susceptible to autoimmune disease than men. And this probably is related to the role that sex hormones, estrogen and progesterone, have in immune function. Now, there are a lot of symptoms that autoimmune diseases have in common. And some of these symptoms can be viewed as early warning signs. So for example, many of us with diagnosed autoimmune conditions can look back over sometimes decades earlier and be able to trace the symptoms that we can now attribute to our autoimmune conditions back to probably when those autoimmune diseases were first starting. So we can look back and go, yes, I had those symptoms, and those were really the beginning of this autoimmune disease. So early symptoms include allergies, anxiety and depression, blood pressure changes, typically low, but sometimes high blood pressure can be related to autoimmune disease. Digestive problems, gastrointestinal symptoms of all kinds can be early warning signs of autoimmune disease. Fatigue, especially extreme fatigue, is a very, very common symptom for autoimmune disease sufferers. Gallbladder disease, as already mentioned. Low blood sugar or blood sugar swings. Malaise, just not feeling well. And this can be one of the hardest symptoms to be able to explain to friends or family. The idea of, I just don't feel good and I can't pinpoint the reason why or what exactly is causing me to not feel good. Memory problems, right? This is sometimes called brain fog. Very, very common in many autoimmune disease. Migraine headaches. Muscle and joint pain is a very, very common symptom across many, many autoimmune diseases. Muscle weakness. PMS, other disorders related to the menstrual cycle, for example, very, very heavy periods, very, very light periods, irregular periods, all of those can be related to autoimmune disease. Most skin problems can be related to autoimmune disease, although certainly not every skin problem is, but rashes, some forms of acne can all be related to what's going on in terms of immune system health. Resistance to weight loss, but any kind of unexplained weight changes can be related to autoimmune disease. Sleep disturbances, which may or may not go with fatigue. Susceptibility to infections. This was one of my earliest symptoms of autoimmune disease, was just getting every single thing that was going around every single time, and always 10 times worse than anyone else was getting it. Swollen glands, thyroid problems in general, so about 90% of problems that are affecting thyroid hormone production, whether that's hypo or hyper, are attributable to autoimmune disease, and frequent yeast infections. So I've already mentioned that autoimmune disease is caused by the immune system learning to attack tissues in our bodies. What makes that attack targeted is the production of something that's called autoantibodies. So an antibody is a tool for the immune system to target its attack against a specific foreign invader. So an antibody recognizes that particular virus, that cold virus that we caught, and helps the immune system identify those viruses in our body, cells that are infected with those viruses, and kill them. What happens in autoimmune disease is an antibody accidentally forms against a tissue, a protein in our body, and that helps target the immune system to attack that tissue. When enough damage builds up that organ can't function anymore, that tissue can't be healthy anymore, that's when we see symptoms, and that's when we can actually diagnose an autoimmune condition. Now, autoimmunity occurs in approximately 30% of us. So that is the production of autoantibodies. That is not the only thing that makes an autoimmune disease. So not only do you have this autoantibody formation, these antibodies that can recognize something in our cells instead of a foreign invader, but our immune system, and we'll get into this more in the upcoming lectures, but our immune system has these ways of detecting this accident and shutting it down. So in autoimmune disease, those fail-safes fail. So the body doesn't go, hey, wait a minute, we shouldn't be making those antibodies, and shuts it down. So there's nothing to rein in that system. And plus, the immune system has to be stimulated to attack. So you need an immune system that's not regulating itself well. You need this stimulation for inflammation, for immune attack. When you have all of those things together and enough damage builds up that we can start to see symptoms, that's when autoimmune disease can be actually diagnosed. What's different between all of these different autoimmune diseases that I've talked about is what tissue, what protein that autoantibody binds to. So if it binds to a protein in the thyroid, then you have a thyroid autoimmune disease. If it binds to a protein in the myelin sheath around nerves, right? Then you've got multiple sclerosis. That's what separates all of these autoimmune diseases is simply exactly what autoantibody is accidentally created. The pathogenesis, right? The way that this disease develops is the same across all autoimmune diseases. The immune system learns to attack our bodies instead of a foreign invader. The fail-safes fail. It's stimulated to attack. Damage builds up. That is the heart of autoimmune disease. So you may or may not be diagnosed with autoimmune disease and taking this course. You might be taking this course to support a loved one. You might be taking this course simply because you have another chronic illness, or you just have some symptoms that look like autoimmune disease, but you don't have a confirmed diagnosis. You may just be struggling with your health and looking for answers. So if you want to ask yourself if you have an autoimmune condition, I mean, certainly if you have a diagnosed condition that's on that list of 140 suspected autoimmune diseases, then you can say the answer is yes. But you can also answer this question if you don't have that, confirmed diagnoses. Perhaps you have symptoms that indicate autoimmune disease, or symptoms that aren't explained by other diagnoses that you may have. Are those symptoms lowering your quality of life? Do you have trouble getting friends or family or your doctor to understand that you don't feel good? If autoimmune disease runs in your family, you are much, much more likely to get it yourself. If you've suffered any of these comorbidity conditions like fibromyalgia or chronic fatigue syndrome, then the chances are more likely that you have an autoimmune condition. It's more likely if you're a woman. Maybe you've done genetic testing and you have some high-risk alleles, which we'll be talking about in the next lecture. Maybe you know that you've got some genes that are increasing your risk of autoimmune disease. Maybe you have some other health challenges that just haven't responded to a paleo diet, a primal diet, a health-promoting diet that otherwise should have made a big difference. Any of those things can indicate that you have an autoimmune condition as the sort of underlying cause of all of your health challenges. And any of those things can indicate that the autoimmune protocol is definitely the right strategy for you.